So today we're going to auscultate heart and lungs. To do this on a dog, you would use your stethoscope and you would place the diaphragm right behind the elbow on the chest while the dog is standing. You would do this on both sides of the dog, both sides of the chest. For cats, you would start out in the center of the sternum and then move outwards to the left and right. Normal heart rate for dogs is between 60 and 160, and for cats 140 to 220. To figure out the heart rhythm, it should be normal. Each heartbeat should be separated by a time interval equal to the next. Heart rhythm, dogs can have a respiratory sinus arrhythmia, which is just when the heart rate speeds up a little bit on inspiration and slows down a little bit on expiration. That is normal for dogs. To best evaluate the rhythm, you would want to listen with your stethoscope, listen to the heart, and palpate the pulses at the same time, and you would want to feel equal intensity at the same time between the heart rate and the pulse. If there is a abnormal heart rhythm, then you would want to do an EKG. Okay, for heart sounds, what you're listening for is the lub-dub, which is the S1 and S2 heart sounds. If you hear an extra one, then that would be considered a gallop, and you would want to do an ECG. You would also be listening to murmurs, which is a swishing sound, and that's the turbulent blood flow within the heart. And if you hear that as well, you would want to do an ECG. Okay, for lung auscultation, what you would do is you would listen with your stethoscope, and you would actually divide the thorax into 9 different quadrants. So 1, 2, 3, 4, 5, 6, 7, 8, 9. And into each quadrant you would listen for 2 to 3 breath cycles. And if the dog is panting, you would want to just gently close their mouth so you could get a better listen. Air movement should be audible upon inspiration and expiration. If you hear abnormal sounds like crackles, that could indicate fluid in the alveoli. Wheezes can occur if there's a narrowed airway. And then if you hear diminished lung sounds, it may mean pleural effusion, pneumonia, a pneumothorax, or even possibly a mass. And if abnormal lung sounds are heard, you should indicate whether it's inspiratory or expiratory. And then you would possibly need to do an x-ray. So, I'm going to perform an EKG right now. So we have this mobile unit. An EKG tells us about the electrical conduction within the heart. So what we're going to do is we have these 3 leads. This white one goes on the right forelimb. I'm going to put it just a little bit below the elbow. It's a little alligator clamp. Okay, the black lead goes on the left forelimb. I'm going to go right below the elbow. And the red lead goes on the left hind limb, and I'll clip it right below the knee. So you need to wet the leads down. We use alcohol. So what we have the dog on a towel to minimize any other conductions. We don't want any other equipment being used. If the dog's shaking, that could give us a false reading. But she's very calm right now in right lateral, and that's the ideal position. All right. So when you're trying to read an ECG tracing, there are 5 questions you want to ask. Is there a P wave before every QRS complex? Is there a QRS complex behind every P wave? Are all the P waves in QRS complexes the same? Are the PR intervals normal in duration, and are they the same? And are the RR intervals the same? So if you look right here, this is our QRS complex. You can see there's a tiny P wave a little bit before the QRS. There is one before every QRS complex here, and there is a QRS after every P wave. And are all the P waves and QRS complexes the same? Without printing this out and actually measuring it, which would be ideal, but so it does appear that all of the P waves and QRS complexes are the same. Are all the PR intervals normal in duration? Again, it would be best to print out the ECG and measure it, but just by looking at this as it's going, they do appear to be the same. Also for the RR intervals, there does appear to be the same amount of time between each beat. So this is a normal sinus rhythm, heart rate of 90, and that is how you perform an ECG. Okay, so today I'm going to demonstrate the use of the rabies pole. You really only use this if you're dealing with a very aggressive dog or someone who potentially has rabies. So once you get it around the neck, what you do is you would pull this string here and it tightens it, and then to release it so the animal can go on their way, is you pull this here just like that. Okay, so I'm going to demonstrate it here. So if they were an aggressive dog, I would kind of keep my foot in front of the door. All right. Okay, I'm gonna tighten it up. Okay. All right, come on, pretty girl. Okay, so this is how you would basically keep the dog at a safe distance like this. Okay. And then we'll come back into the cage and I'll shut the door and release so I can just pop it right off. All right, and that's how you would use a rabies pole. Okay, all right, so we're gonna do a free catch urine here. So the first thing I'm going to do is clean the prepuce, just to make sure to get any bacteria, sorry bud, off the end of the penis here. And you just do it gently, you don't need to scrub really hard. Okay, and I've got my ladle, and now we're gonna get the free catch. So we wanna get it midstream to try to help eliminate whatever bacteria is on the prepuce. Okay, so we want to get it midstream. Okay.
Good boy, George.
All right, and that is how you get a free catch urine sample. Okay, so today I'm going to show you how to clean a cage. We use this Husky 890 Veterinary Disinfectant Cleaner. It's a virucide and a mildew stat. So how you clean the cage is we spray it and let it sit for 10 minutes. And then we will wipe it down. Okay, so it's been 10 minutes. Now I'm going to wipe down the cage. And you can also spray it down again if it's dried a little and looks a little streaky. Okay, and last step would be to wipe down all the bars on the front of the cage, on this side and the outside, and that is how you clean a cage. Okay, so today what we're going to do is we're going to get a sterile urine sample with male intermittent catheterization. So what we're going to do is we have them in lateral recumbency. I am going to extrude the penis. We're going to clean it with iodine. So she's got her sterile gloves on with a sterile syringe, and then she's going to take the sterile red rubber and with sterile lube that she has here on her packaging, and then she's going to insert it until we get some urine back, and then she's going to use the catheter to draw out the sample. So let's do this. Sorry, buddy. Sorry, bud. Okay. Alright, so what we're going to do is do a cystocentesis on this Rottweiler. So I am helping to restrain while Dr. Patino is using the ultrasound to find the bladder. He's got a 6 ml syringe with a 1.5 inch needle. And so we put a little alcohol on the bladder, and he is using the ultrasound to locate the bladder. Now he's getting the sample. Okay, so we got our sample, and now we will put it into white top tubes that have no additives, and that's how you perform a cystocentesis. Okay, so what I'm going to perform today is a Schirmer tear test, a fluorescein stain, and tonometry. So for the Schirmer tear test, what this is it's a little paper ruler. And so what I'm going to do is, while it's in the package, I'm going to bend the rounded tip just a little, because this is what I'm going to put under in the conjunctiva. So what I'll do is I bend the tip a little bit while it's in the package. I'm going to open the package on the opposite end, because I don't want to touch the part that goes onto the eye. And we will do one in each eye. We keep it in there and measure for a minute. A normal reading is greater than or equal to 15 millimeters over a minute. So we're going to go ahead and start here. Okay, so I've got my bent tip. I'm just gonna, and Lauren is holding, a lot of times less restraint is better for this. I'm just gonna put it up under the conjunctiva. Perfect. Good boy. And count for 1 minute. Okay, so it's been a minute. I'm going to take the strip out. And he's been diagnosed with dry eye, which is totally conclusive, because I got 3 millimeters.
Oh, sorry, bud.
Okay, so what I'm going to do now is repeat the whole thing on the left eye. Okay, so what we're going to do now is do a fluorescein staining. So I've got my fluorescein strip here. And so what I'm going to do is I'm just going to bend the strip just a little bit. So when I open it, I can put my drop of water on it, and it goes right down onto the orange staining part. Now, when I'm staining the eye, I don't want to actually touch the eye with the tip of this. I want the drop to just come off and roll onto the eye. After the stain is on there, we'll have them blink a couple times, and then we will use our eye wash and kind of rinse the extra stain out of the eye. Okay, so I'm being very careful not to actually touch the tip of this. I'm keeping it in my sterile wrapper. I'm going to put my drops of the eye wash on. so then when I pick it up, I can just place a drop in his eye. Oops. There we go. Okay. I'm just going to go over and do it on the other eye.
Boy.
All right, so we got the stain in. You're the meanest ever. Okay, so now I'm going to squirt the eye wash to rinse some of that extra stain out.
It's okay,
Buddy,
dear.
you're not gonna like this. So now we're gonna look in the eye. And so the fluorescein staining will tell us if there are any scratches on the eye. Okay, so that is how you look at the eye after the fluorescein stain. For the final eye test, what we're going to use is a tono pen. So what we do, the first thing is we put a little bit of proparacaine in the eyes. So I'll just do 1 drop each eye.
Good boy.
Okay, so the tonal pen, what this is it's a test for the intraocular pressure of the eye. So it tests for glaucoma. A normal reading for dogs is between 10 and 20. So that's what we're hopefully going to get here with Milo. So what we do, every day you should calibrate the tono pen. And okay, so to calibrate the tono pen, you hold it just like this with the tip pointing down. You're going to press this operator's button twice. It will say CAL, and then it takes about 15 seconds, and when it says up, then I flip the tono pen up like this. And then it will tell me if it is a good or bad calibration. So here we go. Good. Boom. Okay, so now what I do is I take off this little paper top. This is a brand new tono pen cover. So what I'm going to do is have Lauren help open the eye. I'm going to come at the eye at a 90-degree angle and just very lightly tap. And it will beep, and then it will give me a reading.
All right. Good boy. Sorry, Milo.
Okay, we got 30. $26.
I'm sorry, buddy.
$33. Tempted. Okay. So that is how you do a tono pen reading. His level was 30, so it's on the high end, and we will be letting the doctor know. But that is how you perform the 3 eye tests. Okay, so today I'm going to demonstrate how to express a dog's anal glands. So every dog has 2 anal glands, or also called anal sacs. And they empty each time a dog goes to the bathroom. Sometimes dogs do have issues emptying them, or they could become clogged or compacted. And you might notice licking back here a lot, or even a lot of scooting the butt on the ground. So what we're going to do is I have my helper here holding the dog. I'm going to put on gloves. I've got Vaseline for a little lubrication, and I've got some damp paper towels to wipe away the expressed fluid. So what you're going to do is you put your gloves on, you get a little bit of Vaseline or some sort of lubricating jelly on your finger, and you are going to use your index finger to insert into the dog's rectum, and you're only going to insert about a ½ inch or so, pretty much just to the length of your first digit. So I'm going to insert my finger into the rectum, and then I'm going to feel on the right and left side of the anus. The anal glands usually live at about 4 o'clock and 8 o'clock if you're using a clock reference. And I'm going to gently squeeze and milk outwards. And it's important to have a helper because most dogs do not tolerate this procedure very well. Okay, so I've got my finger in the rectum. I'm going to place my damp towel kind of over my hand in case there's some squirting action here. It usually feels kind of the size of little grapes if there is fluid in there. So I'm just going to gently milk outwards. His are not very full. Okay, so that was the left side. Feeling on the right side, just a little bit about pea-sized. Just kind of milk outwards. Okay. And then you're going to wipe the rear end real well because sometimes it can really stink. And sometimes you might even want to give a little bath afterwards. I didn't really get anything out. His glands are not full. It should come out as kind of a brown liquid. If it comes out thicker than that, then it means that there might be an issue going on, and the veterinarian should address it. But that is how you express a dog's anal glands. Okay, so today what we're going to do is we're going to perform an enema on this dog. So the first thing we did was we mixed some warm water, not hot, but some warm water, and we mixed it with some sterile lubricating jelly. And this the doctor wanted kind of a 1-in-1 ratio, so about half jelly, half water. So we mixed that in here. We drew it up. We're going to give a 60 milliliter enema. So I have my sterile red rubber catheter, and this isn't a sterile procedure, but this is sterile. It is new to him, and we will be saving this and reusing it, but the first time we do it, it is sterile. So sometimes the doctors want to use soap in with their water, a lot of times with the jelly as well. Sometimes they could use lactulose, but this particular doctor just wanted about 1-to-1 ratio of lubricating jelly and warm water. So what we're going to do here is I'm going to open my catheter, and I'm going to put some sterile lubricating jelly on the tip. Okay, so I'm going to insert this red rubber catheter, and I'm going to insert it pretty far.
Wait, Bubba, hold on. That's good. A little further. Okay, clamp it.
Okay, so she's going to kind of pinch the rectum, and now I'm going to get the air out of the tip of this. There we go. Just nice and steady. All right, and I'm just going to insert this just nice and steady, not too fast. So easily. Good boy, buddy. All right. Okay, and so we did this outside, so it's a little bit less mess to clean up inside. So what we're going to do is we're going to hold the rectum shut for a couple more minutes, and then we're going to walk around outside with him to see if he can eliminate some of that enema. and that is how you perform an enema on a dog. So today I'm going to demonstrate how to apply a topical medication. So what I am using today is called deoxychlorhexidine pads. These are for little yeast infections on the skin, or maybe bacterial or fungal. My dog here, Emma, she does have a little bit of a yeast infection between her toes. Now, normally if I were at the clinic, I would absolutely be wearing gloves. However, I am at home with my dog, so I'm not, but normally I would. So these pads in particular are a cleansing pad, so I don't need to pre-wash the feet. All you do is, this is applied twice a day for 7 to 14 days, and then to be reevaluated by the veterinarian. So all you do for this topical agent is it comes in a little pad, and you just take the area that you are treating. In this case, it is the foot. So I'm going in between her toes, and I'm just making sure that I'm wiping all the areas and getting all of the skin. And I will, once the pad gets a little bit dirty, I will flip it over. Once that other side gets dirty, I will use a new pad. And that is how you apply deoxychlorhexidine topical pads. If I were to be applying something like a topical flea prevention, what I would do is I would part the hair up between the shoulder blades, and I would make sure that I part the hair completely so I am releasing the liquid directly onto the skin. In cats, this is particularly important to do high up on the neck so they can't lick it. And that is another type of topical agent that you would use to apply to the skin. Alright, so today I'm going to demonstrate cleaning and medicating a dog's ears. This is my dog Tommy. I'm doing some of these procedures at home because I work in an emergency clinic and we don't perform these there. But I used to work at a general practice in which we did do these things. So I'm going to demonstrate on my dog cleaning and medicating ears. This is Tommy. So the first thing we're going to do is I have my helper holding him. So what I'm going to do is I have this cleaner here, and I'm going to put some drops into the ear. Now I will be careful not to touch the ear with the tip of my cleaner because I don't want to contaminate it. So I'm going to, and normally I would be wearing gloves. If I was at a clinic, I would be wearing gloves. So I'm going to take some of my cleaner, I'm going to squirt it down into the ear. Then I'm going to massage the ear, and you can hear a little bit of a squishing sound. So I'm just going to massage this for a few seconds. That's breaking up the dirt. And then I'm going to wipe it out with some cotton swabs. And it's helpful if they shake their head. Sometimes Tommy doesn't always do that. Okay, alright, so now I'm going to take my clean cotton ball. I'm going to wipe down in the ear. You can see getting a little bit of debris. Fortunately, his ears were not very dirty. There we go. Okay, just going to wipe a little bit more. If the ears were very dirty, I very well may use the cleaner again and massage and wipe out. However, his are really pretty clean. To apply a medication to the ears, this is Mometamax. This is an ear medication. So the procedure is to clean ears well, let them dry, and then place the medication. So normally we would clean the ears, give it a little time to dry out, and then place the medication. However, for this video, I'm going to demonstrate applying the medication. So similar to the ear cleaner, what I would do is just pull back the pinna of the ear. I would take my medication and I'm going to apply 4 to 8 drops. So I would stick it down close to the ear. Again, I would make sure not to touch the ear and contaminate the tip of the medication. So what I would do, pull back the pinna, do 4 to 8 drops, and then I would massage the ear again to make sure that the medication got down to the bottom and covered the entire canal. You would repeat this process on the other ear, and that is how you would clean and medicate a dog's ears. Okay, so today I'm going to show you how to clean and medicate a cat's ears. This is my cat Bugsy. If I were at the clinic, I would be using gloves to do this. However, we don't typically clean ears and apply ear medication at the emergency hospital that I work at. So I have my partner here holding the cat. I've got my cleaner, and what I'm going to do is I'm just going to pull back the pinna of his ear a little bit, and I'm going to apply the cleanser down into the ear canal, being careful not to touch the ear with the tip of my cleanser. So I've got my cleanser here. I'm going to pull back the pinna a little bit. I'm going to place a couple drops of my cleanser in, and then I'm going to massage the base of his ear to mix the cleanser all around his ear canal. I would do this for a couple seconds and then let him shake his head. Then I would take my clean cotton balls and I would wipe out the inside of his ear. Okay. Then when I was done, before I applied the medication, the ear medication, I would typically give it a little time to let his ears dry. However, for the purpose of the video, what I would do is I've got my ear medication here. It would be applying it very similarly to the ear cleaner. I would pull back the pinna. I'm going to place 4 to 8 drops into the ear canal. I would make sure not to touch the tip of the medication to the ear canal. And then just like the cleaner, I would sit here and massage the ear to make sure the medication was distributed well throughout the ear. I would perform the exact same thing on the opposite ear. And that is how you clean and medicate a cat's ears. Okay, so today we're going to do sub-Q fluids into this guy Ben here. We're going to do 800 milliliters of lactated ringers. So I've got my bag of lactated ringers here in this slam bag, and this is a bag where we can pump it up so it delivers the fluids quickly. I've got my IV line here. It is primed with the fluid. This is a new 18 gauge needle. We use the 18 gauge because it's bigger. We can get the fluids in quicker. So what I'm going to do is I'm going to pull up his skin here between the shoulder blades, kind of tent it up, and then I'm going to take my needle in parallel with the spine. Making sure not to go down because I don't want to poke him in the muscle and the spine, anywhere like that. So Veronica's holding him. I'm going to pinch up the skin, and I'm just going to go right in. Okay. And now I'm going to release the bag, and we're going to give 800 milliliters. And we will do it over a couple different areas just to make it a little more comfortable for him. Okay, so we're done delivering the 800 milliliters. I'm going to pull the needle out. I'm going to hold down on the spot for just a minute with this gauze pad to kind of help it clot up and keep it from leaking out. And then I will explain to the owners that this will absorb into the body over the next 12 to 18 hours. And that it will gradually shift down to his chest area and to expect that and not to be alarmed by it. And that is how you administer sub-Q fluids. Okay, so today we're going to trim this puppy's toenails. Lauren is going to hold his leg out for me. And so what we're going to do, these are small toenail clippers. If you want to come a little bit closer, so you can see pretty easily where the nail kind of curves out at the end. So if you just clip that edge that's hanging over like that, then you pretty much are guaranteed you're not going to quick the animal. So I'm just going to clip these little edges just like that. Good boy. Okay. Let me get his little nail here. Okay, so if I were to quick him, we could use something called Quick Stop, or you can use cornstarch. And what you would do is you would get a little on your finger or have it in a little bowl and then just hold it in there until it clotted. But he was actually a really great patient, so I'm going to go ahead and do the rest of his nails. And that is how you trim a dog's toenails. Okay, today I'm going to demonstrate how to trim a cat's nails. So what I have here is I have a small animal nail trimmer. I had just demonstrated at work how to trim nails on a puppy, and this was the size trimmer I used. However, for my cat's nails, what I use is just a human fingernail clipper, since their nails are so tiny and so thin. So the first thing I'm going to do is have my holder hold him and restrain him while I trim his nails. Okay, so to trim a cat's nails, what you're going to do is you have your clippers in one hand. You're going to lightly squeeze the digit of the cat's foot, or one digit, and expose the nail. So you can see there's a little bit of a pink area here on the nail. That is the quick. So what you want to trim is just that little piece of nail that is arching out. So, and what you're going to do is just trim a little bit off. If you do happen to quick the nail, you can use something like Clotazol. This will help stop the bleeding. You can also use cornstarch if that happens. So I'm just going to finish clipping this foot here. So again, just avoid right outside the pink mark here. You're just going to trim off the very tip of the nail, making sure not to quick him. I'm going to get the little... Okay, and that is how you trim a cat's nail. So what I'm going to demonstrate today is placing an emergency bandage. So what I have here on Miss Tittles, I have a little piece of tape here. It's got a little black marking for the wound. So the first thing that we would do is we would use our sterile lubricant, and I would put it in the wound, and that protects it from any of our cleaner and from getting any more hair or debris in the wound. So I would put my sterile lubricant in the wound. I would take my clippers and I would clip all around this wound, making sure to get the hair as short as I can, and being careful not to damage any of the tissue. After we would clip it, we would take our chlorhexidine scrub gauze, and our chlorhexidine solution gauze, and I would alternate and clean the wound, starting in the center and working out, making sure not to get any old debris in the wound. And so that would be my chlorhexidine scrub, and then I would do my solution, and I would keep alternating like that until the wound was cleaned. Then I would take my 60 milliliter syringe with sterile saline in it. I would have a plastic catheter tip on the syringe, and then I would continually flush the wound to get all of the debris out. After we did that, I would place my non-stick Telfa pad over the wound, and then I would grab my cast padding. So I'm placing the Telfa pad over the wound. I would grab my cast padding. And I would try not to make any wrinkles in the cast padding. And I would wrap it up. Again, this is just an emergency pad. To keep it from bleeding until we can address the wound. Then I would take my vet wrap, okay, so that is how we would clip and clean an emergency wound, and then bandage it until the doctor can reevaluate it. Okay, so for this video, I'm going to apply a modified Robert Jones bandage with a splint. So the first thing I'm going to do is make my stirrups. So I've got my tape here, and I'm going to put it up to the distal 1/3 of the leg. I'm going to place it on both sides. And I'm tabbing the ends so I can separate them easily when I'm done. So I've got my stirrups in place. Now I'm going to place my cast padding. I will start at the toes and I will work proximally. I'm just doing 2 layers, and I'm going to overlap the cast padding about 50% as I go up. I am going to leave a little bit at the end so the toes are exposed so we can monitor them while she's wearing the bandage. Okay, and I'm going to go up here over the elbow. Okay, so I've got my 2 layers of the cast padding with the toes exposed. Now I'm going to use my compression bandage for the second layer. Again, I'm going to start at the toes and work my way proximally. This layer we do a little tighter, and I will overlap it 50% as I go up. Okay, so now what I'm going to do is I'm going to separate the stirrups. And I'm going to twist the tape so the sticky side is down. on my bandage. I'm going to do that on both sides. Okay, so I've got the stirrups in place. The next step is for the splint. And I've got a little splint that would fit this dog's size leg. And what we do is we place this on the back side of the leg. And then I will take my vet wrap and wrap that around the leg for the so for the last step of the bandage, I'll use my vet wrap. I don't want to go too tight with it. So what we do is I rolled the whole roll and then loosely rolled it back up again so I don't make it too tight on her leg. I'm going to start at the toes and move proximally. Again, I'm going to leave the toes exposed so we can monitor them. And also, when I put this up at the top, I'm not going to go beyond this padding because I don't want it to rub against her body and cause any problems. I also want to put the splint down a little bit so when she touches the ground, the splint is there to take the weight. I'm going to wrap up about 50%, overlap about 50% as I'm rolling up. Okay, so that leaves plenty of room up top so my bandage isn't going to rub against her body and cause any sores. And we left room down at the toes so we can monitor them while she's wearing the bandage. And that is how you place a modified Robert Jones bandage with a splint. Okay, for this video, I'm going to show removing the modified Robert Jones bandage. I did want to add in that you can put a little bit of this elasticon on the bottom for a little bit of traction. So what I'm going to do here is just start unrolling. Okay, so I'll remove my splint. I'll peel down my stirrups. And I can just start unrolling the bandage. And then just peel off the stirrups. Okay, so that is how you remove a modified Robert Jones bandage. Okay, so I'm going to take some dental x-rays. This is our unit, and I've got the sensor here parallel to the mandibular molars. You can kind of see it peeking out there. So I'm using a parallel method. Alright, so I'm going to press the button, and once it beeps, let go.
Beautiful.
Alright. Okay, for this we're going to do the premolars. We're using a bisecting angle technique. So I've got my sensor pulled up so it's almost basically where the tongue is in the mouth. And we're going to come underneath here a little bit.
Don't freak out if that pops off.
find the X-ray unit. Boom! Awesome.
Great.
Okay. Thank you.
Oh.
Okay, so for this video, I'm going to demonstrate hand scaling. So I've got my curette here, and I'm gonna start up at the top of the tooth and pull down to try to get some of this plaque. So I'm going to clean this cat's teeth. What I have here is the scaler. This is the dental machine. This has the polisher, the drill, and the air water syringe. So what I'm going to do is clean these teeth. You want to go at kind of a side angle, not straight on, because you could damage the tooth, and no longer than 10 seconds per tooth because you could damage the tooth. Bleed. Yes. Yes. Okay, this is the polisher. So I'm gonna get the polisher into this cup here. So you want to fill it up, and then you're gonna brush it on the teeth. You're gonna go even up under the gum line a little bit. And this polishes away the scrapings you make with the scaler. Okay, now I'm gonna rinse it.
And we're not doing any seals on this table.
Okay.
I pushed it.
Okay, so what I'm going to do now is do a role play with Lauren here, doing a dental discharge. So I'm just going to go over these discharge instructions. So Athena, your pet today, we did just a standard routine dental cleaning. We didn't have any extractions or anything. So, so when you go home tonight, food and water, because they can get kind of excited after the surgery and then to go home. So just withhold food and water for about an hour. Sometimes they're inclined to eat and drink excessively, and then offer a little bit of water. If she does well, doesn't drink too much, no vomiting, then you can offer her a small meal at about 6 tonight. So feed just soft food only for 24 hours and no chew toys for 24 hours. So for elimination, many patients may not have a bowel movement for a day or two after anesthesia, anywhere from 24 to 36 hours. That's totally normal. If there are no bowel movements after that, please give us a call. We are not sending home any medications tonight because there were no extractions done. We have no sutures. We want to do a follow-up recheck in 10 to 14 days. We do want to have you monitor any decrease in activity or appetite that can happen for 1 to 2 days after anesthesia. However, anything beyond that, definitely give us a call. But some things to watch for are loss of appetite over 2 days, refusal to drink water over 1 day, if there's any weakness, depression, vomiting, or diarrhea. If you see any of those things, please give us a call. We do recommend home dental care. We recommend teeth brushing and to start 14 days after the cleaning, so 14 days from now. Ideally, brushing once a day, but I know that's very hard to do. So we have this CET dental toothpaste that we're going to give you and a little bitty toothbrush. Something that you can do is just get Athena used to having stuff in her mouth. So what we recommend is getting like a little wash rag and just using a little bit of water at first and just kind of, go around her mouth. Do that for several days, once a day. And then you can start to add some of the toothpaste.
Vanilla mint.
Yeah, I know, my dog really likes that
too.
And then hopefully you can work up to a toothbrush, but even just a washcloth with toothpaste is better than nothing. We also are giving you some dental chews. You can do one of these once a day. There's a couple different brands. The Hills Prescription Diet, there's a CET brand, and then there's an Oravet brand. But these are what we're going to give you today. Okay. So do you have any questions?
No.
Okay.
Yay.
All right, so I'll bring Athena up to you.
Thank you.